Hey everyone, thank you guys for joining me today. So in today's video, we're going to talk about some of the tips I have for you coming up for the Thanksgiving holidays, how you can help out with your reflux, and I'm going to give you my recommendation about what I'm going to do to keep the weight down, help out with my gut issues, and hopefully help you guys out with some of the issues that could be happening when you guys enjoy that really good Thanksgiving meal. I love Thanksgiving. It is my favorite holiday of the year, and because of the foods that we eat, it's going to make people feel really bad. So let's see what we can do to help out with that. So for those of you guys who are joining me today, my name is Dr. Samir Islam, and yes, I am a poop doctor. My passion is to give you tips and tricks to help out with your gut health. If you're new to the video series, every Tuesday around this time, I do a Facebook Live where I delve into one topic for the week to help out with your gut health. At any point in time in the video, if you have a question or a comment down below. This is a live video. And if you're watching this on the replay, click on the comments down below where I'll give more information what I'm going to talk about in today's video. But before we begin, don't forget to like me on my social media pages. Smash that like button. If you're following me on Facebook or Instagram or YouTube, make sure to click that like button so you can follow me for more videos. And let's see what we can do to hopefully help out with your gut issues. But in today's video, I will tell you exactly what to do for GERD when it comes to the holidays. In addition, I'll talk about what we can do to help out with some of your gut issues that you may be having with your gut health. So let's go and talk about poop. GERD sucks. It is terrible. A lot of people have this. It is a really bad problem to have. It can present in a lot of different ways. For some people, it can be burning in the chest. For some people, it can be regurgitation. And we all know that when you have acid reflux, it can really affect the quality of your life. It can affect your sleep, your work. Let me know in the comments if you've had people who suffered from reflux, or if you know somebody who suffered from reflux, you've had issues with respect to sleeping, work, and your quality of life. I've had reflux in the past. I know for me, it's woken me up in the middle of the night, prevented me from having the sleep that I want to have. And not only that, I can't enjoy the things I normally want to enjoy, including things I want to do with the rest of my family. So it really it's a really crappy disease to have. It really sucks. And the problem when it comes to acid reflux is that the more you enjoy your life, the more you're going to have reflux. And Thanksgiving and the holidays is not only is it one of the best times of the year, but it can be really bad for those people who suffer from heartburn and from acid reflux. So what can we do? So when I tell a patient that you have acid reflux, what do I mean? Or if you're wondering about what acid reflux is, here's what we mean. So reflux, the medical definition, is the reflux of gastric contents into the esophagus to cause troublesome symptoms. And for a lot of people, this can cause a lot of different issues. Now, the typical symptoms when it comes to acid reflux includes heartburn and regurgitation. If you come to see me and say, hey, Dr. Islam, I have heartburn, well, I can tell you for a fact that's acid reflux, and you may be suffering from that. Or if you come to see me and say, hey, Dr. Islam, I have regurgitation, well, I can tell you that is acid reflux. Let me know if you've had issues with that or if you've had problems with that. But there are also atypical symptoms that are not typical for acid reflux. This includes things like chest pain, hoarseness, cough, or even asthma. A lot of people don't realize that asthma can be a symptom of acid reflux. And for a lot of people who have acid reflux, asthma may be their only presenting symptom. But also you can have the sensation of what's called globus, or this frog in the back of your throat. And for some people, this can be their manifestation of acid reflux, even though they may not have typical acid reflux symptoms. Then you can have other associated symptoms with reflux. So you can have dyspepsia, or this feeling of just kind of indigestion, upset stomach, not feeling very good, or queasy stomach as well. You can have epigastric pain as well. You can have bloating and belching, and also nausea. These are symptoms that you can have when it comes to acid reflux. And I think Terry, thank you for commenting on the Facebook Live. So Terry has said that she suffered from past acid reflux in the past, where it has disturbed her night, and for sure it can help out, and it can actually make sleeping at night a lot more difficult as well. And for me, when I have acid reflux, for sure, it really does make my sleep a lot worse. So now that we talked about acid reflux, let's talk about how can we fix this. There are going to be 4 simple things I'm going to recommend when it comes to acid reflux symptoms, and I want to talk to you about exactly what I'm going to recommend so you don't have to suffer from the holidays. You can have your acid reflux taken care of, and you can actually maybe enjoy the things you want to enjoy. So number 1, you may want to try taking over-the-counter medications. So We know when you have really, really bad acid reflux, especially when it hits you all of a sudden, the over-the-counter medications are probably going to be the best options when it comes to acid reflux. So for me, the things I recommend: antacids, Maalox, Gaviscon Advanced. There are a lot of things that I recommend when it comes to acid reflux. And I'll put a link on the Facebook Live about my website for some of my more favorite over-the-counter treatment options when it comes to acid reflux. But one of the things that actually does not help out when it comes to immediate acid reflux is taking additional acid-reducing medication, like a medication like a Nexium or a Prilosec. Doubling up on the medication actually may not help you out in the immediate symptoms for acid reflux. So the things that can help it immediately are things like antacids, Gaviscon, Maalox, and Rolaids. I would keep this handy, especially if you have acid reflux and you know you're going to have a meal that's going to make your reflux symptoms a lot worse. You really need to pace yourself. I know it's hard. A lot of people eat with their eyes. Their eyes are bigger than their stomach. And for a lot of people who have acid reflux, you want to make sure you pace yourself. Don't go crazy eating a ton of food in a short amount of time. Enjoy the food, take your time, enjoy hanging out with people who you want to hang out with. But really, really, really try to pace yourself, because when it comes to acid reflux, the more food you take into your stomach at one time, the more acid that can be produced, the more burning you can have, and the more regurgitation you can have as well. If you want to sleep better and you're having issues with sleeping, there's very good evidence that sleeping on your left side as opposed to your right side can really make your acid reflux symptoms better. The reason is that the angle between the esophagus and stomach becomes a lot more difficult for acid to go up into the esophagus if you're on your left side. So if you're going to sleep, especially during the holidays, if you're going to watch football and after you have a good meal and you want to lie down on your left hand side. And also, a lot of my patients use a wedge-shaped pillow, or they use bricks to elevate the head of their bed as well, which should make it easier to deal with acid reflux. Let me know in the comments if you guys have done things like this when it comes to acid reflux symptoms as well. And then lastly, get moving. Really, you have to move around. If you sit around, and this is really hard whenever you're in Thanksgiving, but if you can move around, walk around, maybe take a walk, go outside, really learn to move around the body, because the more you can move around, the easier it's going to be to control your acid reflux, or at least control the immediate symptoms when it comes to acid reflux. But these are the 4 tips I'm going to recommend to hopefully take care of your acid reflux or heartburn in the holidays. If you do this, I really do think you're going to control a lot of the symptoms of how you're going to have when it comes to your reflux symptoms. I really do think it's going to make things easier and better for you whenever it comes to your heartburn symptoms. So, my question for you guys: what has helped out with your reflux? What have you done to help out with your reflux? Let me know what things you have tried, especially when it comes to acid reflux in the holidays. I want to thank you guys for joining me today. Every Tuesday around this time, I do my Facebook Live where I go into one particular topic for the week to help out with your gut health. And every Thursday, I do my Poop Tip Thursday where I try to drop one poop tip for the week to help out with your gut health. I want to thank you guys for watching this video. Don't forget to follow me on all my social media pages, on my Facebook, my Instagram, and my YouTube pages as well. And if there's any questions you guys may have, I'm going to stay on the Facebook Live a little bit longer to see if I can answer any more questions. But I want to thank you, Jane, for joining me, Terry, and Jimmy for joining as well. And so Jimmy made one particular comment when she mentioned the hiatal hernia. So let's talk about a hiatal hernia. So a hiatal hernia is when part of the stomach goes above the diaphragm. And for a lot of people, especially if it's a large hiatal hernia, this can make it more difficult to control acid reflux symptoms, but also can make complications from acid reflux symptoms a lot more harder to manage as well. And for some patients who have a hiatal hernia, there are a couple of things that we can do with that. For some people, it may be just medications and lifestyle changes, and that may be enough to control the symptoms from a hernia. But there are some people who actually may need surgical repair of that hernia, especially if you have recurrent acid reflux, or especially if your reflux is not controlled with acid-reducing medication or lifestyle changes. These are the options that we can do when it comes to controlling your hernia and also controlling your acid reflux from hernia as well. And for a lot of people, it can be a very serious condition and can really make things a lot more difficult as well. Perfect. All right. Well, I think that is the end of some of the questions that we have so far. So I want to thank you guys for joining me. Next Tuesday, I'll do another Facebook Live where I'll delve into one topic for a couple of minutes ahead of time. But I'll stay for a little bit longer to answer any questions you may have about your gut health, your medical health, and what you can do to hopefully help out with your gut issues. So I want to thank you guys for watching this video. I look forward to seeing you guys on more videos. Thanks and take care. Have a wonderful, happy, and healthy Thanksgiving, guys. Stay safe. Y'all take care.